years ago, we started the Global Initiative on Young People's Sexual Rights and Health with a belief that was both simple and radical. That young people should not just be included in conversations about their own sexual health and rights, they should be leading them.
We asked ourselves, what would it take to ensure that all young people are able to freely exercise their sexual rights without the fear of reprisal?
How can we improve equitable access to the services necessary to improve sexual health outcomes?
E finalmente, como a gente pode garantir que as perspectivas desses jovens não sejam apenas solicitadas, mas uma parte central desse processo de mudança?
We built a model grounded in 3 interconnected pillars: education, research, and policy engagement. We needed to build the evidence base to support an understanding that young people's sexual health and rights needed to be prioritized, and that it's possible to create an enabling environment for sexual health and rights to be achieved.
This in turn would allow us and our partners to advocate for much needed change and push back against the tidal wave of regression we're witnessing in both the US and globally.
All 3 pillars focused on amplifying youth voices and expertise, but none more so than our fellowships in the US and in Brazil.
Basic and essential health and hygiene is a right and not a privilege. This includes access to holistic sexual education. We are on a mission across our intimate wellness impact work to ensure that young people remain empowered, informed, and confident in regards to their sexual health and rights.
Through the Sexual Rights for Social Change Academy, dozens of young people were trained in strategic communications techniques, which they integrated with new knowledge on sexual health and rights.
We learned how to leverage evidence-based information and turn it into powerful narratives that capture attention and change minds, reaching hundreds of thousands of people globally.
Nossas equipes em São Paulo e Los Angeles fizeram estudos inovadores para compreender e entender a experiência de jovens sobre seus direitos sexuais, sua saúde sexual e seu prazer.
Os jovens não foram apenas participantes da pesquisa. Eles foram pesquisadores, contribuíram para a formulação do questionário e interpretação dos resultados.
We created pathways for young advocates to engage in global policy spaces, from the UN Summit of the Future to the 25th International AIDS Conference.
These weren't symbolic seats at the table. These were platforms for us to shape conversations about policies that affect our lives.
Desde então, jovens do mundo todo mostraram que é possível.
Our youth-centered educational content on sexual health and rights has achieved more than 1 million views organically and counting.
We've reached people in over 35 countries across 6 continents, from Botswana, the Dominican Republic, to the Philippines and New Zealand.
Treinamos 76 estudantes como embaixadores entre Brasil e Estados Unidos.
Our research generated new evidence into young people's sexual health needs, evidence that will be used to inform programs and policies that actually reflect our realities.
We created hundreds of videos, myth-busting content, wrote op-eds, and we even built advocacy campaigns, all made by young people for young people.
We saw young people show up and engage in UN spaces, at international fora, feed into policy dialogues, contribute analysis and perspectives to help move this work forward.
For me, this initiative meant learning that I could talk about sexual pleasure, consent, and bodily autonomy without shame. I found a community that understood that sexual health isn't just about disease prevention, it's about joy, dignity, and human rights.
Significou perceber que crescer numa comunidade que tratava a educação sexual como um tabu era exatamente o que me impactava como educadora. A minha experiência importa e a minha voz tem valor.
It meant realizing that I don't have to choose between being an activist or being a professional. I can be both. I can bring these values into whatever career I choose, and I can keep fighting for what's right.
Being a part of real research and advocacy efforts, not just learning about them, but actually doing them, showed me that young people belong in knowledge creation. Our voices and perspectives are essential.
O projeto mostrou que quando a gente investe em jovens de forma significativa, não apenas incluindo, mas fornecendo recursos e plataformas, eles não só atendem às nossas expectativas, como as superam de formas que nós jamais imaginaríamos.
I am taking these skills into my career in pharma, how to communicate complex ideas, how to center community voices, and how to advocate for policies that actually serve young people's needs.
What stood out to us as partners is the sophistication and the strategic leadership these young leaders brought to the campaign. They weren't just passionate, they were skilled, they were informed, and they even brought a human right and equity lens to the campaign, so it was both creative and effective.
Estou levando essas conexões para o meu trabalho de advocacy e luta por direitos.
I'm taking the courage to keep having hard conversations.
Jovens não estão apenas formados para lidar a política de saúde global. Eles já estão liderando. O trabalho deles já está modificando e transformando comunidades políticas e vidas.
Scaling innovative training methods.
Pushing back against regression.
Harnessing digital platforms for good.
Garantindo que todos esses jovens possam exercer seus direitos sexuais.
Building a coalition of committed partners.
Bringing young people directly into the conversation. Creating content that meets young people where they are.
Transformando linguajares sobre saúde sexual e direitos.
proving that youth leadership isn't the future.
It's now.